Hello, Dr. Bob Ganz. Today I want to give you a very quick overview on fiber, what fiber is and its importance, how it plays off of the bacteria that live in our system, the human microbiome, and how that fiber microbiome interplay can help or cause GI symptoms. So let's dive right into it. So what is fiber? We talk about fiber all the time, but what is fiber? So fiber, all dietary fiber, are complex carbohydrates that come from plants or fruits. Fruits are parts of plants. So fibers are complex carbohydrates that come from plants. And fibers are at least 10 monomers strung together, so at least 10 sugar monomers that humans can eat. We can eat fiber, but we can't digest it. So humans can digest simple sugars, things like glucose, fructose, galactose, etc. But humans don't have the enzyme systems to digest more complex carbohydrates. So we can eat fiber, but we can't digest it. But fiber can be fermented by bacteria. Now, when a human eats something and derives nutrients, we call that process digestion. When a bacteria gets exposed to foodstuffs and gets nutrients from it, we call that process fermentation. So humans digest, bacteria ferment. Now, fibers have different characteristics. We've already said that all fibers by definition are not digestible by humans. We can't digest it. But we can characterize fibers by different characteristics. So solubility, does the fiber dissolve in water or not dissolve in water, or is it partially dissolved in water? Is it fermentable? Can it be totally broken down by bacteria, partially broken down by bacteria, or barely broken down by bacteria? And is the fiber totally dissolvable in water, or is it gel-like, bulking, or is it viscous? Different characteristics of viscosity. So solubility, how soluble it is, fermentability, how much it can be broken down by bacteria, and viscosity and bulking. Now, what is the fiber in a typical Western diet? If you look at diet in Europe or America, about half the fiber that we eat, shown in the dark blue and the dark yellow, is either cellulose or hemicellulose. The dark blue in this graph is cellulose, the dark yellow is hemicellulose. So about 50% of what we eat is cellulose or hemicellulose. And the rest of the fibers that we eat are a mix of lignans, beta-glucan, pectins, fructans, galacto-oligosaccharides, resistant starches, and gums. But the main part of our diet is really cellulose and hemicellulose. Now, there is no perfect fiber. Various fibers with various characteristics, the solubility, fermentability, viscosity, etc., can yield different clinical results. So in general, fibers that have different properties or combinations of fibers with different properties yield the most gut microbial diversity, the most number and diverse bacteria in our system, and the best effects on the GI tract. So I'm going to talk to you today about a product called Relievance. This is a very nice fiber blend. This is a blend of 8 fibers in one dose. So Relievance fiber is 8 fibers in one product. So this is psyllium, wheat dextrin, beta-glucan, inulin, pectin, guar, cellulose, and flaxseed. Aspagula is another name for psyllium. So this product, Relievance, 8 fibers in one blend. So it's a mix of soluble and insoluble fibers, fermentable and partially fermentable fibers, and solubles that are bulking, gel-like, and non-bulking and non-gel-like. So it's a very good mix of different fibers. So Relievance is an 8-fiber blend. It's a very novel combination. Each fiber in there has various characteristics of solubility, fermentability, and viscosity. And so a blend like Relievance helps to restore gut health by creating a very healthy, diverse, robust microbiome. This helps decrease gut inflammation and helps to restore a normal bowel habit, improves bloating, gas, and digestive discomfort by this novel combination. Now, the human microbiome is immense. You have 100 trillion bacteria that live in our system, mostly in the colon. And in a healthy situation, you get a good blend of fibers, various diverse fibers, shown on the left here, with a good, robust, healthy microbiome. And this leads to a very healthy gut lining with good, healthy mucus production, decreases gut inflammation, and helps restore good energy dynamics, energy intake, and glucose insulin dynamics as well. On the right side is an example of somebody who takes in either not enough fiber or the wrong kinds of fibers, or somebody who has dysbiosis. They don't have a good healthy gut microbiome, and that interplay of decreased fiber intake or not diverse enough fiber intake plus dysbiosis of the gut microbiome leads to an inflammatory gut, not enough mucus production, no healthy mucus production, and then you get separation of cell-cell junctions from inflammation, and then metabolites and inflammatory mediators can leak across that leaky gut and create systemic inflammation and gut inflammation. So the gut microbiota, along with a healthy microbiome, determines gut health. So the right combination of bacteria and the right combination of fiber will help combat things like constipation, diarrhea, can help restore a good good healthy nutrient extraction and good glucose insulin dynamics. It can combat bloating and gas and can help things like irritable bowel syndrome. And the gut microbiota can also determine systemic health. So if you have altered microbiota or altered microbiota fiber dynamics, then you can get things like type 2 diabetes, metabolic syndrome, can also lead to systemic issues like coronary artery disease, atherosclerosis. The microbiota can also determine response to vaccines and medications, chemotherapy, and mental health. So it's very important to have a very healthy, robust, good gut microbiota in response to a healthy, diverse fiber intake. So just to sum up, Relievance fiber, a good 8-fiber blend. This is just pure fiber. There's no additives, no sugar, no preservatives. It's just fiber. It's tasteless. Very healthy product. Will help you restore a good, healthy gut microbiota. So that's all I'm going to say today about fiber and the microbiota. So good luck with your journey on gut health, and you take care.